speaking about how much we can do, but how is the quality? So Islamic doesn't insist about the quantity, but is insisting about quality. If even quantity, it must be the second step after quality. ليبلوكم أيكم أحسن عملا. لم يكن أيكم أكثر means not the more, but the best quality. To do a job for examining any patient, for any system, for any disease, you must be systematized. Okay? You must be able to concentrate in a certain flow. You know, if we are going to examine the abdomen today, at the end of our session, we must be able to arrange our mind so we know 1, 2, 3, 4, 5, 6 until whatever the number, 10, 20, and we will do it regularly with each patient so we can pick the important clinical signs. If we are not prepared like that, we will miss a lot of our clinical signs, okay? So let us come again to the present now. Can you see the slides now?
No, doctor.
Okay, just tell me, share the screen. Then I will open this one. Is it clear now?
Still can't see the slides.
Share your entire screen. But now the lecture is here, but you cannot see. How can we sort it now? Okay, just cancel now, and then let me press here to see. Turn on capture maybe? Not? Still not?
Still no, doctor.
Present now. From a window, okay. So I will go to this one. Still?
Still no, doctor.
Still can't see it, doctor.
Okay. I think now is okay.
Now we can see.
Oh, Alhamdulillah. I don't know, this is the first time to come to the hospital here. Okay. So let us start again by al-Kitab. بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم. Today we are going to speak about abdominal examination. This is an important photo from the basic medical science, okay? Which you must remember the 9 part of the gastrointestinal tract, either upper or lower, right or left or middle, because every one of this, if you read, you will find a lot of details, okay, about that. Okay, here can be pancreatitis, can be something related to stomach. In the other area, it can be related to the liver, here related to the appendix. So this picture is very, very important, and you need to revise it, and we will discuss after. Second thing, I speak with you before about observation. So who can tell me what he can observe from this picture on the right upper?
Yellowish discoloration of the sclera.
Very good. Yes. What is the meaning of that?
Jaundice.
Jaundice. Okay. It is very important. So if I got, I mustn't miss that, because if you are not concentrating, you may miss jaundice in a patient. Very good. In the upper left.
The type of surgical surgical site.
Very
Surgical
good.
scar.
Surgical scars. One of the easiest way, if you need to fail, is to miss a scar. Okay, so if we find any scar, we must comment about where is it and its characteristic, and I must measure it by a meter. How many centimeter is it, and is it old or new? Is it complicated or not, like keloid, like incisional hernia, whatever the complication, infection? Okay, and give interpretation why this patient did that one. Okay, and everyone has its own indication, either appendicectomy, either exploration, either hepatobiliary atresia operation, Kasaya operation, or either splenectomy. A lot of cases. So please concentrate on it. What about the child in the middle?
Frontal bossing.
Only frontal?
Thalassemia face.
Yeah, thalassemia face, which you could include also malar, okay, known as mongoloid feature. It is a complete feature you must read about. What you can see in his chest X-ray, in his skull X-ray. It is very important. You must be able to comment about X-ray. This is one of your curriculum. So you can see now what this looks like hair on end. It means the bone marrow is very active even in the skull bone. So you can see how thick is it and how it looks like there is an air inside that bone, which means hyperactivity of the skull. What about the picture to the lower right?
Ascites.
Why ascites? How can you tell ascites?
Abdominal
Abdominal
distension.
distension.
Very good. Abdominal distension can be 5F, which is
Yes.
okay.
Letter.
Okay.
Fetus.
Fetus. So it is very important to concentrate. It may be not until you make confirmation. What about this blood film? One of the criteria which I need. Who is my group? Is it group 2? Okay. I am mentee for group 2 or group, which group?
Group 2.
Group 2. Okay, so one of you will speak to me about, from the group, he will make for all batch, inshallah, how to read a full blood picture. And another one speak about blood film. So one from group 2 will assign for how to read a full blood picture, and the one read how can we read the peripheral blood film. Okay? And you will inform me by the name in message today, inshallah. Here, it is just some illustration how can we do examination of the organ of the body. Because many times we are asking the candidate to examine the abdomen. Usually he will try to palpate liver, spleen, but he will forget to do the ballotment for the kidney. And he may diagnose at the end, this is a nephrotic syndrome, a kidney case. So it is not good at all. We have liver, we have spleen, we have kidney. Don't forget the 3 organs. Again, yesterday we speak that we must focus on the disease and the patient feeling. Okay, our interview must be warm and friendly with no interruption, with good eye contact, to be a good listener and observer and be sympathized and supportive. All this, every one of this will guide you to be successful clinician. Listening, observe, empathy, support, logic in your way of thinking. Okay? As we speak, the number 1, we must introduce ourselves to the other. I am a medical student, am I a doctor, am I a car, whatever. I am going to do that. Is it okay? And get permission. And then wash your hand. Don't get permission from the child, please. The child, if you ask the child, can I? He will say no. So what you will do? You get permission from the family and they try to play with the child. To tell him, hi, we are going to play together. I would like to see your tummy, and they make it just action. But don't ask until he is adolescent and they can understand, okay? So must introduce yourself. As I told you, hand washing or hand rub is very important. How to go the history. Every one of you are going to write his long case and must go all through this one. Try to remember the name of your patient and his gender, a boy or a girl, okay? Remember also that there is the art of differential diagnosis is very important. I think our colleague in the internal medicine got a nice book about the art of differential diagnosis. And at the end, remember that most of the time you are breaking bad news to the family about either diagnosing of a disease or severity of the disease or whatever. And the family may be very worried, even you are diagnosing a simple disease which you saw it 100 times. Remember that we are a human being and have different feeling and different interests, okay? Equipment, your equipment means it is equipment. It must be in your hand. Don't miss it, please. To be professionalism, as I told you, your appearance is very important. Your mannerism is very important. Your kind attitude, it will offer you love and happy from the people, and also it will offer you acceptance from Allah. Be highly responsible. Okay, don't miss any medical moral. You mustn't speak about confidentiality about anyone. There is a lot of moral. Okay, you must be confident, but not over. You must hand rub and cleaning your hand. Okay, all this is very, very important for you. Try to make the time of examination a simple and acceptable time for the patient and the family. As we speak yesterday, even if the examiner is standing on the right side, tell him, sorry, can I go to the right side to examine my patient? Sometimes during your master or PhD or like that, the examiner intended to stand at this area to see. You are very shy, you will not go through the rules. No, give him, sorry, notice, please. I need to be to the right side. He said, yes, okay, and they will make one tick for you. You are a good and no, okay? Use usually your right hand for palpation and like that. Keep sequential manner of examination. As I told you, you will be into good introduction, good observation, and then good peripheral examination, and at the end, good examination of the system requested. And one more, what is the other system I need to examine? It may be, will confirm mine. Like if I diagnose patient with asthma, The problem now in which system?
Respiratory.
Respiratory.
So what is the next system I need to get a look rapidly? Respiratory system for hypersensitivity or allergy. So the next system will be
Cardiovascular.
Cardiovascular.
asthma predictive index, retrieve the eczema. Okay, that's the very important. If I'm examining a patient with nephritic glomerulonephritis, the next system it may be blood pressure and the heart effect of the blood pressure, encephalopathy or like that. Okay, so we must be able for that. We must expose the patient, but take care about two things: the privacy and the dignity. It is not allowed because we are a doctor or whatever, we leave the patient without cover, especially his private area. Whatever, we must keep the privacy and the dignity for anyone. Okay, keep speaking with the patient and the family, make a good rapport and get good relationship. If the patient need to answer anything, don't get a look to them that they are very superficial. Please take care about that impression to the family, which is very bad, and it means that you are not professional. Be a good listener and give smile and start from the level which the family are thinking about. It is just flu. Don't worry, mom. It is influenza. It may be they are very worried. It can be COVID. So you just tell them, I asked already about any traveling, any like that, and your child has only mild rhinitis. He was not traveling. He is not in contact with any patient, and I asked for that to rule out a dangerous thing. So don't underestimate two things: the family or the mother observation and the mother query. Please put it as your time, especially the mother. The mother know her standard of her child, and any change, she can pick it very early. Okay, of course, all of us, the tooth of our body is not 100%, but it looks like. But if you found one half of the body is bigger than the other, like that, so asymmetry is a very important in the exam. And as we speak yesterday, we are getting to look for the patient. He looks well or ill, is dysmorphic or not. What about his nutrition? And he's alert or not? Is comfortable at bed or not? He has any respiratory distress? He has any acute or chronic disease like diarrhea? Yesterday we speak about dehydration. Does the patient clean or not? Okay, has any signs of neglect or abuse? Remember that child abuse have many stages, started from child neglect. Is the patient look irritable and biting his nail or not? Okay, it is a very, very important. During touching and palpation, it is very important to alarm the child. I am going to palpate your abdomen. Don't hurry and put. You must make it as a routine. I am going to palpate. I am going to percuss. Does it hurt you? Did you feel any pain? Because you are not allowed to cause pain. And I still remember one of our colleagues. He's a very clever, but he's very irritable during the exam, and he just asked the patient to sleep and start to press, and the patient said, the examiner became very, very upset and failed him. He was in MRCB and he write 3-time fail. He insisted to let him to fail 3 times because he make a very strong pain to the patient. So please take care about that. Even as we speak before, Islam insists no harm. You are not allowed to cause any harm for anyone. Okay? Your job is to relieve the harm and the pain. Sometimes if someone has a cold hand, especially in childhood, take care please to hand to be warm. even your stethoscope, if the atmosphere is good like nowadays or inside the clinic, make sure that your stethoscope also is not very cold. Palpation of the abdomen is very important. Here I am writing for you. Try to distract or conversation or question regarding the history during the examination of the abdomen, because the child, when you start, he will make rigidity for his abdomen. So try to distract him, speak with him so he will relax. Otherwise, he will, every patient you will see, you will say the patient has rigidity of the abdominal wall. Rigidity, it means you need a scar to be opened to discover what is inside the abdomen. Okay, muscle relaxation is a goal for that. So you'll ask him to flex the thigh and the knee. This is better. And try to distract him so his abdomen will be very clear, so you can now feel easily the liver, the spleen, the kidney, the peristalsis. You can auscultate, you can check for ascites, all this. So two important things: flexion of the thigh and the knee, and try to distract the patient or speak to him so he is not concentrating in your hand, and make your hand sympathize. I mean, it is not cold. So the first step in examining of any part of the body, whatever I asked you today for abdomen, for chest, for heart, for whatever, is survey of the patient and look for his mental status. He's awake or in coma, what is his posture, his movement looks normal, or he is a special child and has spasticity or decreased movement. What about his gait and walking manner? Has any breath odor? Sometimes you can diagnose. If the patient has odor of acetone, he may got diabetic ketoacidosis. What about his skin? Has any abnormality, any signs of certain disease like SLE or eczema or cafe oil spots, which there is a good relation between the skin and the brain, because both of them are coming from the ectoderm. So there is about 10 or more diseases known as neurocutaneous syndromes. If you found some clue in the skin, you must go and look for the brain for neurocutaneous. The most famous one is neurofibromatosis and the tuberous sclerosis. Okay. So observation is very important. Abdominal examination, a well-conducted examination of the abdomen can reveal agreed information. But if you did it poorly, you will get nothing. And you lose the patient to confidence as you miss his diagnosis. Okay? Everyone has his own technique with the time, but adjust it according to the circumstances. Because I used it to tell an example. If you are going to examine an infant and he is sleeping at the time, some of you need to rush and put the child, get the baby from the lap of his mother and put him in the bed. And once the child opened his bed, he found a white coat. What he will do?
Cry.
So what is the benefit to be rush to irritate one who is sleeping now? If he's sleeping, just even during the exam or not in the exam, if you are during your teaching, sorry, prof, it is a good chance that he sleep. Can you auscultate his heart and chest before a week? I will consider and give you 1 star because you understand that dealing with childhood is different than adult. So at the time, even if I find a small baby unto 2 years who is very panic or have stringent anxiety, I will keep calm I didn't want to get him out of his motherland. I will not him ask to appear. I will not ask her to remove the clothes. I will just, sorry, mom, give me a while, and I will prepare my stethoscope and see, auscultate the heart, and then auscultate the chest, and then palpate the abdomen until that the baby is slightly asleep. Let him awake, and I can examine the nervous system, which is the remaining one. So the good pediatrician is a good opportunistic. Yes, you must have your own flow, but you must be opportunistic. Okay. Of course, we have different problems in the abdomen, which can be acute abdomen with abdominal pain. It can be abdominal mass. It can be chronic condition affecting the abdomen, like ascites, with edema, with nephrotic, with chronic inflammatory disease like that. Okay, but just remember, even for any system, not all things we are described must be done fully for every patient. But your knowledge of the full routine is important to be settled in your mind. Okay? If I send you that one, you have two video about how to examine the abdomen in kids and adolescent. It is very good one, but I think the net here is not good. So in that slide, you can hear it, inshallah. So if I asked you now, please, can you examine the gastrointestinal tract or the abdomen of this patient? Okay. So you are going to approach the child. So again, after introduce yourself, getting permission, hand wash or hand rub, exposure and position, you will comment to me. You didn't touch the patient. The patient looks well or unwell, conscious or not. His nutritional status is good or bad, but you will say, I would like to plot him on height and weight growth charts. Why? Centile measurement is very important, so I must plot him. I will ask, is there any medication or nutritional drink, okay, on the table beside him? Any attachment like cannula, monitoring. For all this, you can get it only by observation. And if you miss it and run directly to enter the abdomen of the baby, you will miss all that knowledge. You see before, when we see the first slide, this eye has jaundice, and this face has mongoloid feature, and this area has a scar, and. So don't jump. Observation will cost you few seconds, but it will help you a much to come to the diagnosis. Also, you must comment. So number one, is well or unwell, and about nutritional status and the growth chart. And you must ask yourself, for every childhood, is there any dysmorphism? Dysmorphism can be more with congenital heart disease, but also there is some like myelopolysaccharidosis. You will find the hepatosplenomegaly. You will see like Hunter or Horler or another mucopolysaccharidosis. MBS. Okay. Then you must get a look for the skin. Why? It is very important, the color of the skin. If you saw him yellow, is a jaundice. Green, also jaundice. If he has like any bruises or like that, it is very important. Sallow color, it will occur with the kidney failure. Some said like mud or earthy color. Okay. Is there any increasing body hair or facial hair? It will occur with some medication like cyclosporin given for some types of malignancy or autoimmune diseases. You will find increase the hair. Is there any skin rash like dermatitis herpetiformis? It occurs with certain disease. Is there any telangiectasia? Telangiectasia means abnormality of the blood vessel. It makes like connected together the blood vessel known as telangiectasia. It is considered one very famous syndromes. Perioral freckling also occur with syndrome known as Betz-Jeher's disease. Pigmentation, if it is cafe au lait, as I speak to you before, cafe au lait, it is like cafe au lait, very famous, okay, in Malaysia, okay. تهتري ولا or cafe au lait is occur with many diseases. The most common one is neurofibromatosis type 1, okay, and another. You will comment about nutritional support. I mean, is the child getting his nutrition normal, or he has a nasogastric tube, Ryle's tube? It is very important if a child is a big enough and still put Ryle's tube. What did you suspect? I found a child 5 years and still putting OGT tube for feeding.
Malnutrition.
Malnutrition? No. What
reflux problem.
Also for reflux, you are not retrieving chronic feeding by NGT tube or Ryle's tube.
There is delay in development.
Yes, if the patient has global developmental delay and he has something known as pseudo-bulbar syndrome. What is pseudo-bulbar? You know the midbrain, we have 3 parts, bones, midbrain, and medulla oblongata. Yes, medulla oblongata, midbrains. If the nerves like 9, 10, and 12 are affected, it will cause pseudobulbar syndrome. That means the child cannot suck and swallow. Usually this is in severe cases of cerebral palsy. Okay. Another one, which is the BEG, gastrostomy tube. Now they are calling it percutaneous endoscopic gastrostomy. In spite of putting this Ryle's tube from the mouth or nose, you are going and make small operation, just endoscope, and you will introduce one tube and keep it in the tummy of the child to give him the feed instead of upper. So it is known as percutaneous endoscopic gastrostomy tube. Okay. If there is any urinary catheter, you must try to go and check what is the color of the urine, bloody, whatever. Okay. If you find all the child is still wearing nappy, still has diaper, 9 years and still have diaper, I will ask myself, does this child got severe diarrhea? So the family need? No, he has no diarrhea. So what I suspect, it is the same. The child is still incontinence, which can go with severe cerebral palsy or some kind of spina bifida. Spina bifida, which is myelomeningocele. Okay? Myelomeningocele, it is a defect in the lower back, in the spine, usually will affect lumbosacral area, but sometimes it is very high, even affecting the thoracic area. And I saw one patient recently also affecting the next spine. So all this will guide you that the patient is not normal. Did you see how much observation is very important and how much knowledge we can get by the first glance to the patient? Again, generally well or unwell, he looks dysmorphic or not. What about any problem with the skin, any problem with the nutrition or nutritional aids? And then we are going to examine the hands. And the hand and the palms are, and the arms are very, very important. Okay, you can see finger clubbing. You must know how to diagnose clubbing. by the finger, either between two thumbs or between two index. It is very important. And if you find, you must rule out some important diagnoses like cystic fibrosis, liver disease, inflammatory bowel disease, celiac disease. Okay. Of course, the nail are very important. It can guide you either for iron deficiency anemia or even cirrhosis. Palms, palm erythema will occur in chronic liver disease. Okay. Hepatic flat, which is liver failure or renal failure, also auto retention can cause some abnormal movements. If you come to the arm, you will find some abnormality like tendon xanthomas. If the patient has high lipid cholesterol and like that, it can appear even very early because it is autosomal disease. If you find any bruising, it can guide us that the patient has liver dysfunction or hematological dysfunction. If the patient are scratched, we must ask ourselves, it is just allergy or it is a part of just general diseases can cause a scratch, especially if the patient has high jaundice and like that. Spider nevi is an important one of liver problem. If you go and look for the face and the neck, you will see the eye, as we see before, jaundice or anemia. Is there any Kaiser Fleischer ring? It is very important. If you look to the eye of patient with a disease known as Wilson disease, you will find around the pupil brown one, as if a cover, as if it is a cover around the eye. Okay. If they found the face is plethoric, it means they has chronic liver disease. If cyanosed, we must check where is it. Okay. What about the mouse? It is very important. Sometimes you will find pigmentation. You can know about some. You are not asked at your level, but there is some syndrome can cause pigmentation inside the mouse. If there is ulcers, like aphthous ulcer, can occur in Crohn's disease, inflammatory bowel disease, celiac disease, Behçet disease. Sometimes it is familial also. If you find the gum hypertrophy, the gum in front of you, it is not so simple. If you find the gum hypertrophy, it may be either the patient has myeloid leukemia or cyclosporin or phenytoin, some drugs can cause, unless the patient has chronic inflammation. So it is very important. If you found the gum with the patient who is coming to you, gum hypertrophy, and the patient presented to you by severe anemia and thrombocytopenia and white count. So you have pancytopenia and the gum. So you must put in your mind this patient may got myeloid leukemia. Okay. The tongue also, if it is big, it may be accompanied by hypothyroidism, especially in small age. You will not find a lot of signs, but if you find the tongue starts to be big, there is many syndrome, but the most famous one is the hypothyroidism and the other mucopolysaccharidosis. Okay. Glossitis can occur in some iron or vitamin deficiencies. Okay. Even if you are examining the neck and chest, gynecomastia are very important. Remember that gynecomastia during the pubertal time is acceptable even in boys, and it will settle with time. But if you find significant gynecomastia, either in very small or very old patient, you must check about any liver problem or not. Okay, again, so start by introduction, observation, okay, and then go through the skin and any nutritional support, and start from peripheral about the hands, palms, arms, and then come up to the skull, eyes, face, mouth, gum, tongue, neck, and then we'll come to the abdomen itself. We need to speak about the shape of the abdomen. It looks normal or abnormal. It means if the patient are scaphoid abdomen, it means either he is a very, very malnutrition or some other causes. If the abdomen is distended, So you must ask yourself, is it generalized or localized? It may be malignancy. And remember, as we speak before about feces which can occur at Hirschsprung disease, flatus or fat or fluid like ascites. Then an obvious mass which you will palpate it by superficial palpation, then you need to confirm by deep palpation. And if you found any mass, you must measure it. Don't tell me, yes, the abdomen looks to have a mass in the abdomen. Where is it? It is in the right lower quadrant. So how large is it? I didn't measure it. No. If you found any mass for any time, you must go and measure, please. Also scar, as we speak before, a scar is very important, especially if you found a small scar which is endoscopic scar or laparoscopic scar. Growing and examining the genitalia after getting permission and after keeping the dignity and take care about the age of adolescents, you must be very cautious, but usually we must get a look, is there any inguinal hernia or not? Is there any renal transplantation, which the palpated mass, sometimes it will be put down here, the kidney, okay? Also, there may be with the subcostal margin, we may find some abnormality like cholecystectomy, okay, or splenectomy. We have a lot of scar. We must go through it. Which part of the abdomen has which operation? I just write it just to remember. If you have time, you must go through it, okay? And you must be able to prescribe, as I told you before, how long and is it new or old and is it complicated or not, and what is the indication for that one. Stria are very important. If you examine the abdomen, stria, I mean like streaks. Usually we know the stria alba, which occur with the pregnant woman. It will be stretching of the skin. But if you find stria rubra, you must take care. It can be steroid toxicity, like in case of Cushing disease. Okay, caput medosa are very important. If you found vein coming from the umbilicus, you must check the way of the blood. Is it flow away from the umbilicus or not? So different from superior vena cava obstruction. If the obstruction in the superior vena cava, the flow inferiorly, okay? Inferior vena cava obstruction, the flow will be superior with the reverse. So it can guide you where is the obstruction. It is not so common, but in cases of suspected portal hypertension and like that, it is very important. Other things, sometimes you have stoma, okay? You have fistula, you have tubes, whatever you have. So make care that if you see anything, said it is not normal for anyone to have something like that. You must ask yourself, maybe peritoneal dialysis or like that. Important of blowing tummy and flattening tummy is very important to rule out rigidity by movement, because sometimes when you touch some people, they are very irritable and stretch their abdomen, and give patient to raise the head or cuff. It will guide you if there is any hernia or divercation of the recti. Okay, so just elevate head or cuffing. If there is hernia, it will appear. Superficial palpation is very important. The patient should be in the supine position. However, if the patient has gross ascites, you might want to ask him where is comfortable for him to lie. This means the doctor is a wise man. He may consider every situation. Be sensitive. Tell the child, I'm going to feel your tummy. Please let me know if you feel any pain or if you want me to stop. Okay? You will write this one to me by Malaysia. Saya what? Saya suka Can you hear me?
Yes, we can hear you, Doctor.
Tell me by Malay what I will said. I am going to feel your tummy. Please inform me.
Saya nak rasa perut awak.
Saya?
Nak periksa perut. Check.
Okay, I will make it practical inshallah soon when I saw you. Okay. So if you feel any pain, any second, you want me to stop, inform me. While palpation, very important also. If you are doing palpation for the abdomen for any child, you must look at the face, not at your hands, not at the leg, because it will guide you if it has pain or not. And there is a very nice video. The doctor is still compressing it to feel the liver, and the patient up and is going to cry and the tender, and the doctor is not here. It is not good. Okay. It's the best to be in the right side of the patient and heel down in your knees. So it will be at the level of the patient. Okay. You may start from systematize from left iliac or right iliac as you wish, but you must be systematized and don't miss. But usually we are considering starting from the right iliac fossa, not from the left, okay, to check for both liver and spleen. Deep palpation, you must palpate deeper for any deeper mass. Again, warm the child that you are going to feel deeper. Ask him to tell you if he feel any pain. It is very important. Liver is very important. As I told you, we have 3 important organs. For the liver, as you can see in the picture now, palpate upward from the right iliac fossa toward the right subcostal margin until you feel the liver edge. Ask the patient to take deep breath and try to feel the liver edge as it descends. So your finger is stand and the liver is knocking you, okay? If you feel a mass, describe the surface. Like the liver now, you must describe, is it soft or nodular? What about consistency? It is a hard or soft? What about the edge, regular or irregular? So it is very simple. If you come and you said, I can palpate the liver, about don't say about finger, because the finger of male is different than female and there is no standard finger. So you must measure by centimeter. Even during your practice after that, if you measure by three fingers, you mean that 3 fingers are calculated to be like 4 centimeters. This is different, but for the exam and to be professional, you must measure by tape measure, please, okay? And you must be able to comment about the surface, is it smooth surface and soft consistency and regular edge or other answer, okay? Percuss from the right lower quadrant of the abdomen. Why? Because sometimes the liver are very big and you can miss it. So we must start from the appendicular side, okay? Until the sound change from resonant to dull, this donate the liver lower border. Then percuss from the right upper chest downward, starting in the mid-clavicular line at about 3rd intercostal space, percuss inferiorly until the dullness denote that the liver upper border. So by that, you need to measure, especially sometimes the liver is not enlarged, but you also comment the liver span. And we have span for just newly arrived baby, like 4 centimeter. It will be enlarged with time until 8 centimeter. For adult, it will be 11 or like that. So we must know the liver size for every age. Spleen, of course, is very important organ, which most of you looks a bit clumsy in examining the spleen, and it mustn't be. Okay. Also, the spleen will be palpated from the right iliac fossa toward the left subcostal margin. As you can see the arrow, can you see it?
Yes.
As you, okay. As you reach the left subcostal margin, ask the patient to turn slightly toward you, his right side, and palpate the subcostal area. At that time, you mustn't palpate spleen. Okay, dullness to percussion over the trops area, which one you must run one video for that. It is very important. Okay, may indicate splenectomy, although this also can be normal findings after meal, or sometimes it can occur with other disease like pleural effusion. Okay, so it is very, very important. You will ask the patient to come. Remember that usually we are not able to palpate the spleen until it is 2 to 3 time enlargement. Okay, sensitivity and specificity for this trops area are very important, but it is, if it is resonant, it will assure you. But if it is dull, you just tell dull, but you must confirm by other signs like trying to palpating the spleen and like that. Okay, so the spleen are very important. Again, we are going to start from the right iliac fossa toward the left costal margin, and ask the patient to turn to his right side so you can palpate the subcostal area. Dullness to percussion over the trop space may indicate splenomegaly or others. Okay. Kidney is the place which you must use 2 hands. That's why we call it palpation. Place 1 hand under the patient in the right flank region and the other hand on the top, and try to palpate. Palpate means moving it between your 2 fingers. The 2 hands repeat for the left side. How differentiate between liver, spleen, and the kidney? It is very important, but let us finish this one. Shifting dullness. When I will do percussion, if there is abdomen is distended, I will do shifting dullness or fluid thrill, and then auscultation to auscultate the bowel sound. Remember to auscultate the abdomen for the bowel sound, which, as I told you yesterday, it is a few number 4 to 6 per minute. If it is very increasing, it means there is hairy peristalsis. If not, it may be ileus. Liver bruit is very important. If you hear bruit, means it is the same like murmur. It occurs with some diseases. If you put your stethoscope in the liver or the spleen and you can hear bruit, it can occur with neurofibromatosis, hypertension like that, or sometimes arteriovenous malformation. Let us see this slide, please. Here, I started for the liver from right iliac fossa and measure the upper and lower border. So the liver, it is moving with respiration. I mean, when I ask the patient to get a big breath, the liver will come and try to touch my finger. Okay, and also I cannot go above it. If I feel the liver large, I cannot come over it because its upper border is in the chest up. Okay, and it is present in the right hypochondrium. So it is dull, move with respiration, cannot get above it, and it is in the right hypochondrium. About the spleen, it's dull and move with respiration, but it has a notch. Especially if you have patient with thalassemia, will find the spleen enlarged, and you can feel the notch of the spleen, which is indicative that it is spleen, not kidney, and you can go above it, the same like a liver, but its direction, as we see here, it is in the splenic area. What about the kidney? The kidney is resonant, doesn't move with respiration, and easily palatable, and you can get above it. So please, you concentrate at this slide because you don't have excuse to be confused between spleen and the kidney. Okay? Do you need to repeat anything about this slide?
Secure.
It's okay. So now, please, you must go through it and know liver, spleen, kidney, and how to be unconfused about different organs. Again, how to do palpation, the degree of muscle rigidity or resistance may be made by light palpation. One should determine whether the abdomen will exhibit voluntary muscle tightness or actual rigidity. That's why we speak about that. For voluntary tensing of the muscle is brought about through the fear or nervousness. It can overcome by proper technique. The proper technique begin palpation in an area of the abdomen that is farthest from pain. If you tell you I have pain in the right iliac fossa, don't run to check the right iliac fossa, go to the left iliac fossa and the epigastrium and go up. Because if you start to touch this in the child, he will be very afraid and he may refuse again. One should determine whether the abdomen will exhibit voluntary or not, muscle spasm. So as we speak before, please try to flex the knee, flex the hip, and try to chat with the child to distract him. Percussion, as we speak before, it is a part of abdominal examination. Many times you are examining and you are very happy, really, you picked the liver and spleen, and asking you what else, you are forget to do percussion for shifting dullness, especially if the abdomen is distended and the fluid thrill. You must auscultate, your stethoscope must be ready in every abdominal examination to hear, as we speak before, bowel sounds, liver bruit, renal bruit, or other. What others? We have hernial orifices, we have genitalia, we have to examine the back and the perineal area. If there is this, especially in small babies, if he has passing urine and stool, you can get an idea. The renal examination, we need to confirm by blood pressure and urine examination and the signs of steroid toxicity. One important lesson, please, for all of us. In our life, we cannot accept one view of anything, yes? You need more than one view. Did you agree?
Yeah.
Yes, yes.
Yes.
So please, if you are going to examine any organ, don't accept one view. I mean, I am examining now the heart. Yes, I will auscultate the four area of the heart, the aortic, pulmonary, apex, like that, tricuspid. But I must auscultate also from the back. Why? If the patient has heart failure, I can auscultate the fine crepitation. If has pleural effusion, and I can feel it. There is some murmur can be heard in the back, like BDA and pulmonary stenosis. So don't accept one view. If you are going to auscultate for the chest also, anyone can tell me if I'm auscultating from front, which lobe of the lung is it?
Base of lung.
No, from front, not from back. From front, I'm auscultating now the upper and the middle lobes. Where is the lower lobe? Lower lobe at the back. I can auscultate it in the back. So if you auscultate upper and the middle lobe and they are normal, it doesn't mean the patient has no pneumonia, because we have some pneumonia known as basal pneumonia. It came to the base, to the lower lobes. Okay? If you're examining the heart, the chest, the abdomen also, if you ask the patient with the abdomen to auscultate the back, you may find the scar of kidney biopsy. You may find some abnormality in the bone. You may find some tenderness in the kidney site, which means pyelonephritis. It is very important. even if you are asked you to examine the motor system of the lower limb, it is better to get a look in the back. It may be the patient has spina bifida. So please don't accept one view in your life. Try to confirm by another point of view. This one for you to go through it, please. Causes of hepatomegaly can be structural, can be storage disease, can be hematological disease, can be vascular or cardiac, and can be infection. The same for spleen, but the different etiology, and you can find some diseases combined both hepatosplenomegaly and even ascites. So this is the cause of hepatosplenomegaly, and this is the cause of ascites. Remember that ascites can occur with cirrhosis, with congenital congestive heart failure, with hypoalbuminemic state like nephrotic syndrome, with infection like TB, with malignancy, with hepatic vein thrombosis, and with pancreatitis. All this can cause ascites. So believe this three and the coming one, I just put it to you to go through it. Hepatomegaly, all these causes, splenomegaly, that one, both hepatosplenomegaly and causes of ascites. Portal hypertension, I didn't want you to go deep, but remember that portal hypertension, one of its criteria is the splenomegaly and the ascites. So just put it in your mind, because we have many cases can cause portal hypertension. It is not at your level, but remember just portal hypertension presented by spleen and ascites, enough for you. This one from a very nice book, Pediatric Examination, Australian book, is author known as Brian. He make it very nice, really. And I am happy with his manner. You can read down how to examine the gastrointestinal system. Will introduce yourself, general inspection, and then demonstrate fat and protein stores, mean nutrition, and then check the upper limb, check the head and the neck, then abdomen, okay, and then go for the posterior aspect, and then don't forget to look for the lower limb for any edema, and what other do you need to do. By this one, that is the concept which I need you to work with it. You see now the patient in front of you, and you need to comment all about that. Is it clear?
Clear, doctor.
Yes, Doctor, clear.
Please, after we finish our lecture, you need to go through it, please, because I will examine you once I saw you for the clinical examination after 1 week or like that. I will examine you for that. So this is an example. This is another example of examination of the abdomen. What we can see here from the picture, if you ask it to examine the abdomen and you found some rashes, and it may be joint, and it may be abdominal pain, and the purpuric rash, it is very important to rule out some causes, because our body is integrated, okay, like Hinochin lung purpura. It is very important. You'll find the patient with abdominal pain, but when you see, you'll find purpuric rashes, okay, and you must go through all that. And this one for examining of a small baby, okay, with jaundice. Please, it is very important. And this one, how can I comment on the nutritional status of anyone, which is apart? As you know, gastrointestinal tract, its main function is to offer us with enough calories. Okay, so we'll also go through the inspection, demonstration of facts, and then go through the skin, upper limb, chest, okay, abdomen, nervous system, okay, cardiovascular system, other. So you will know why this patient is not thriving normally. He has any problem with his abdomen, with CNS, with heart, with respiration, chronic disease. All this will guide you during the examination of the nutritional status of the child. Now, did you get the message?
Inshallah, Rabbi.
Yes.
Can I ask you some questions?
We'll try our best.
Okay. قل رب زدني علما. This is just praying to Allah. The best thing for the humankind is not more money, but more knowledge, and make use of this knowledge. Okay. Sayyidina Ali, when asked what is the best, the money or the ilm, he said ilm is best than money by 10 ways. Inshallah, we will try to discuss it after. Okay. Who will raise his hand to be number one?
Doctor,
Yes,
what's brute? B-R-U-I-T.
Brui. It is like
Brute.
murmur, like murmur.
Oh, so it's based on auscultation?
Yes.
Okay, thank you.
In the heart, it is murmur. In the other area, it is Brui.
Oh, okay. So that means it's the sounds that the other organs make?
Yes, yes. If there is like the most clear one is if we have arteriovenous malformation. Did you see, if you see some patient with fistula due to chronic renal failure and dialysis, and you put the stethoscope, you will hear a very clear murmur, but we are calling it murmur or bruit. Okay.
Okay. All right. Thank you so much.
You will continue with me. What's your name?
Me. My name is Alisa.
Alisa, sorry, my screen is fully now. I cannot see you. So, Alisa, I will
Yes.
ask you one question. Okay.
Okay.
Go through it.
Sorry?
Go through this question, please.
Oh, okay. 14 months old, breastfed male infant was noticed to get puffiness in lower limbs and lost smiling. He has mild hepatomegaly, mild ascites, and no jaundice. His serum potassium was 1.3, sodium 1 to 8, blood sugar 56, plasma albumin 1.5, and hemoglobin was 8.3. Okay. What am I supposed to do?
So what can you understand? This is a child just 1 year plus. You can see his picture. What you can see in his picture?
I can see abdominal distension and like on the face, the child has some sort of like, I can't tell if it's rashes or scars. And on his hand, on the right hand, also like there's some sort of scars or rashes, I can't tell. And then he looks yellow, I mean
He
jaundice.
looks buffy. No, he looks buffy.
Mm,
And his hair looks like brownish one or red one.
his what? Sorry?
The hair color. In some
Oh,
cases, you will find the hair color are different. Okay, and he looks like beavish one. He is not so happy one.
mhm.
So what did you suspect can be the diagnosis here?
Um, liver disease.
Can be liver disease. Yes, he has hepatomegaly. but he has very low albumin. What is the most common cause of low albumin?
Let me think.
Who can answer? Hypoalbuminemia is a famous disease of nephrotic.
Nephrotic syndrome.
Yes, but is this a child that nephrotic syndrome?
Okay.
So
What was the question?
What is you cannot see the screen? What is?
Now I can see it. Now I can see it. Sorry.
So what is the diagnosis?
Like you may said, maybe nephrotic syndrome.
No, you can see.
Wait, syndrome is not diagnosis. Syndrome is a collection of symptoms, right?
No, nephrotic syndrome is a diagnosis, but here.
Oh, it can be diagnosis.
What is the
Kwashiorkor.
diagnosis? Yes, it is very important. That is to say, I give you an important impression. Don't be hurry, because even if patient is edematous and hypoalbuminemia, still he can be other than that he is Kwashiorkor syndrome. Okay, so who can answer differential diagnosis now? Another candidate. It will be renal edema like nephrotic syndrome, as we speak before. But important lab result, I will check urine for albumin and the serum for cholesterol, because the criteria for diagnosing nephrotic contains all this. What can be the complication? Of course, malnutrition can accompany by repeated infection, electrolyte disturbance, hypothermia, hypoglycemia. Okay.
Okay, doctor.
Who is ready for the second question? I need one to assign. You said I am the one. I must open the names and choose. Yalla. I need someone to start. Are you ready or not?
Yes, sir.
You can read, please, the question number 2.
Okay, I will read. Okay, a 9-year-old boy has fever. Wait,
Yes.
okay. A 9-year-old boy has fever, excessive somnolence, and severe anorexia with vomiting and abdominal pain. He has yellow-colored urine, skin and sclera. Liver was felt 5 cm below costal margin, soft and tender, with no splenomegaly. His serum ALT is 345, serum AST 623, bilirubin uh, 4.9, direct bilirubin 3.7, and his prothrombin PT 16. So the question is,
So can you summarize for me?
okay, the boy, 9 years old, has fever, excessive somnolence, and severe anorexia, and also has vomiting and abdominal pain, and has jaundice. and he has also hepatomegaly, but there is no splenomegaly, and
So what is
his
the
blood
diagnosis?
the diagnosis acute hepatitis.
Good. It is very important for anyone eating outside door. It is very important to take care about hepatitis A. Now we have vaccination for hepatitis A. It is not compulsory, but it is very important. You must know the normal and the abnormal for your lab result. So you must know how much is the alt and ast or SGOT and SGIT. Okay. How can I confirm hepatitis A?
How?
Confirmatory test for hepatitis A is very simple. It is serum, IgG and IgM
Oh,
for hepatitis A. It's a very common disease if there is bad sanitation like that. But serious complication can lead to permanent hepatic failure sometimes, especially if it came to eldest one. How to protect? Yes, we can protect. There is immunoprophylaxis and immunization. It is very important and available vaccination against hepatitis A. Who is number 3?
I can read it out for you, Doctor.
Okay.
A 13-year-old girl presented with a sudden onset of fever, vomiting, headache, and opistotonic position. The cerebrospinal fluid reveals white blood cells with 380 cells with more than 90% polymorph nucleate. Okay. And then the glucose is 35 with protein 102 and random blood sugar was 97.
So this is an important point now. The child now presented by vomiting and fever. So if we didn't complete our examination, okay, and see it can be central problem or not. So when we did this CSF, we find the white count is very high, which usually it must be less than 10. What is the meaning if I found the infection in the CSF? It means
Meningitis,
very good. So what is the most accepted diagnosis now is?
acute bacterial meningitis,
MashaAllah. What may be the cause?
maybe strep pneumonia.
It is meningococcal. Okay, let us see here
Okay.
why we said bacterial, because polymorphonuclear are the predominant one, and the glucose is low. Usually, sorry, I finished the marking for one of my. After lecture, I will give it to you. Okay, can be. Sorry, are you leaving now or not? Okay, inside the meeting room, there is one bag. I put it inside, so no one will touch. It is trigger 3. Yeah, one of the trigger 3 there. Child inside a yellow bag in the chair, not in the table. You can put it, and the other one I will finish and drop it there, inshallah. Welcome. So if you found the polymorphonuclear are very high, okay, and the glucose is low, usually glucose must be 2/3 of the blood. You can see now this is 35 and this is 95, it means only 1/3, and the protein is high. All this will go due to bacterial meningitis with streptococcal pneumonia or meningitis, pneumonia meningitis. Okay. Common complication you must know can cause severe sepsis and DIC, can cause abscess, can cause very important, can affect the vision and the hearing. So in any patient got meningitis, you must check the hearing and the vision. Third generation cephalosporin and ampicillin must be given as early as you can. If you suspect some microbe, you may need to add steroid also. Okay, like pneumococci. Starting steroid before or with the antibiotic will decrease the hearing loss. Okay. So this, the previous one give us an important issue that sometimes the complaint looks like related to one organ, the family is coming, and my son has repeated vomiting like that. So I am distracted now and thinking about gastroenteritis or other. If I am not going to check for meningeal signs and like that, I will miss the diagnosis. Who can comment for this number 4? No one is keen to answer. Okay, I will leave it to you, but I will ask you in the future about all the cases. If we forgot, this is a very common case. This one, you can see the picture here. What is the name of this?
Beating edema.
Beating edema. What is this?
Periorbital edema.
What is this?
Hematuria.
Is it clear hematuria? It is
Tea-colored urine.
tea or cola color urine, because hematuria, if it came from up, from glomerulonephritis from upper, it will come down with this color. If it came from down, it will be fresh. So if we speak about this 3-year-old boy with this characteristic, okay, and then when we did the urine analysis, we found a lot of RBCs, YBCs, and the RBCs casts, and the mild proteinuria, and ASOT is 800. So it will help us to diagnose
Acute post-strep glomerulonephritis.
Yes. So this one will, sorry, where it was inside the bag?
No. Oh, inside the bag.
Just a while, I'm coming to you. Yes, Assalamu alaikum.
Waalaikumsalam.
So this is very important. All this sign will diagnose glomerulonephritis, but this one will diagnose the cause, which is post-streptococcal glomerulonephritis. So the accepted diagnosis is acute post-streptococcal. Complication is very important. The most common is with renal failure is the hypertensive encephalopathy. Many patients of this will come to us with conversion due to severe hypertension cause hypertensive encephalopathy. If you are not away, as I spoke to you yesterday and didn't measure the blood pressure, you can miss the diagnosis. Other investigations are very important, okay? And your treatment is CPN and the antihypertensive, okay? When it is very important, when do I need to do renal biopsy? Okay, if I found everything is normal and rapidly C3 became improved and rapidly progressive renal failure, I must think about doing renal biopsy. Who can read that one?
I'll read it for you, doctor.
Okay.
An 8-year-old child has periorbital, scrotal, and lower limb edema. There is positive transmitted abdominal thrill. He has urine volume of 0.5, protein of 56 milligrams, and lipid cast. Serum C3 is normal, albumin 2.1, and cholesterol 342.
So I finished the first half. After this lecture, Dr. Tafi did it, I think. I think I saw him doing the yellow color stuff. Dr. Said there, you can ask him. Said even the room. The room. Yeah, it is three. Three people, me, Dr. Tafi, and Dr. Said. Okay, so this is a very important point. If you find edema, you must ask yourself how extensive is it? Is it there in the face? Is it there in the abdomen? Is it there in the dependent area and the genitalia? Is it there in the lower limb? Is it there in the abdominal ascites? Is it there in the chest, which can cause like pulmonary edema or pleural effusion? But here we can find this C3 is normal. And there is lipid cast, and the albumin is low, and the cholesterol is high. So what did you suspect the diagnosis can be?
Nephrotic syndrome.
Nephrotic syndrome.
To diagnose
Lipid
nephrotic
cast.
syndrome, we have 4 criteria, which is proteinuria. Proteinuria, it means there is leakage. If there is leakage of the protein through the urine, what will happen for the blood protein?
Reduce.
Hypoalbuminemia.
Hypoalbuminemia. And then we'll find also cholesterol is
Increased.
It is very important, okay? But this patient also has decreased urinary output. Okay, it is very important. So the diagnosis, as you said, it is nephrotic syndrome. Usually it is idiopathic. Complication, it is very important. Infection are very common. You must know why infection are high in patient with nephrotic syndrome. And also is susceptible for renal vein thrombosis because the increased cholesterol and the fluid like that, all this can cause thrombosis and the gross failure, of course. There is another complication, you must go through it, okay? When I do in nephrotic syndrome renal kidney biopsy, it is very important. If the low C3, which means it is mixed picture of nephrotic and nephritic, if it is resistant or dependent or persistent hematuria, or started to get a renal failure and the progressive one. So and some prefer, if you are going to start intensive treatment other than steroid, you must consider that one, okay? As I speak before, what is the normal for investigation, you will go through it. This is a very important one. Who can read?
I'll read it out for you, doctor.
Another. I need, otherwise I will.
Let me.
Yes, new face with new look, please. Yes.
An infant 10-month-old on buffalo milk has vomiting, watery diarrhea, and excessive thirst. He was given excessive WHO ORS. His serum sodium was 156, blood pH 7.1, and total serum creatinine is 4.3
milligram. Take care that there is, you must know how can you change between milligram and the millimole. This milligram normally up to 1 milligram. So what did you suspect?
I would suggest gastritis or gastroenteritis.
Okay. What's the type of gastroenteritis? You can see here the sodium is 156, which is a normal 135 to 145.
Hypernatremic.
Hyponatremia.
Hypernatremic. What is this pH? What is the normal for this pH? It must be 7.35. What did you suspect?
Acidosis.
Metabolic acidosis, yes. What about this creatinine? The normal is 1. So it is renal failure. So I have now dehydration. I have hypernatremic dehydration. It is deteriorated with acidosis and renal impairment. So it is AGE, which we speak yesterday, with hypernatremic dehydration and pre-renal failure. Listen to this. It looks a beautiful diagnosis. I mean, it's not beautiful to say the diagnosis like that. It is AGE with hypernatremic dehydration and pre-renal failure. Is it better, or I asked you what is the diagnosis? AGE, alhamdulillah. What is the dehydration? The doctor has severe hypernatremic dehydration. He got any complication? Yes, he has pre-renal failure. What is best is not to waste your knowledge. You have the knowledge. Just try to collect it together. Is it clear? This is yesterday lecture. So AGE, hypernatremic dehydration, pre-renal failure. Other signs of dehydration, we got it yesterday. Okay. How can we set the percentages? If it is moderate or severe or like that. Okay. Yesterday we speak about that. You see now, this is the picture which I speak to you before. Who will present this one?
I can read it, doctor.
Okay.
A 6-year-old child developed painful swollen both knees with non-itching maculopapular and ecchymotic rash over the buttocks and lower limbs and darkly red urine. Platelet count was 332 times 10 to the power of 3 cmm. Urine RBCs were 43 HPF. Protein 33 milligram per m2 per HR, and RBC cast ASOT was less than 200 200
Unit
per liter.
So let us evaluate. This is a 6 years old. Okay, has joint pain. Is it arthralgia or arthritis? He told you the painful swollen. A swollen one of the any itis which you got it during basic medical science is hotness, redness, swollen, and you remember all that. So he's got arthritis. and has this maculopapular rashes in typical presentation in the buttocks and that extensor area. So I must think out can be the diagnosis.
HSP.
Yes, but HSP is not enough because they had got a signs of glomerulonephritis. Did you remember? There was red cell castis and all these criteria. So this one of the complication of HSP. The serious complication is glomerulonephritis. Can cause also bleeding in any vital organ. When you are going to start any one of the above, started to be complicated or severe, not non-responding abdominal pain. There a disturbance of platelets? Of course, no. The normal value, you must go through it, please. Okay. This is a very important also how to make comprehensive diagnosis. HSP with glomerulonephritis. Still, we have two. Who will read?
Me.
Okay.
Let me read it. A 4-year-old girl suffers abdominal pain with there is history of similar attacks since 1.5 years. Urine examination, turbid aspect, yellow and bad smell. Specific gravity is 1020. White blood cell more than 100 HPF. RBC 56 HPF. Hyaline and granular cast. Urine volume was 1.3 ml per kilogram per hour. Urine nitrate is positive.
Can you see this X-ray?
Yes.
What did you suspect can be the diagnosis?
Recurrent UTI.
Recurrent UTI.
How can we differentiate by just UTI and pyelonephritis? If the patient started to affect the kidney up with getting fever and rigor and like that, it is pyelonephritis, which indicate that the patient need to be admitted and given intravenous treatment. The issue of repeated UTI or recurrent UTI can cause renal scarring. And the renal scarring can end by renal failure. Okay, so take care about that. Don't underestimate the importance of diagnosing and the treatment UTI. It can cause renal scar. That's why we are making one specific image known as DIMSA scan. Okay, dimer of urine scan for this one to check is there any scarring or not. Okay, that's why we have ascending cystourethroskop and DIMSA. Okay. Usually this one is the cause is the vesico-rhetoric reflux, which was not diagnosed. A vesico-rhetoric reflux, it means that we have only one way coming from the kidney to the ureter, to the urinary bladder, to the urethra and the outside. Okay. If there is reflux, it means the urine will go for the other direction. What is the bad effect of that is repeated UTI. And this UTI can make renal scarring and pyelonephritis and even, as you see here, some sort of hydronephrosis. So remember that micturating cystourethrogram and DIMSA scan are the gold standard. Okay, micturating NCUG and DIMSA scan are the gold standard for that. Now we are getting the last one. Who will read?
May I read it, doctor?
Okay, it is not abdomen, but let us go through it.
A 3-year-old child has severe stridor, RD, drooling of what is RD?
Rheumatic disease.
Oh, rheumatic disease. Thank you.
No.
Respiratory distress.
Yeah, thank
Okay,
you,
thank you.
because I am the one who hates abbreviation. Okay.
Drooling of saliva, dysphagia, and high fever. He is toxic, irritable, and always sitting in the bed leaning forward. Complete blood count show white blood cells, 22 times 10 to the power of 3, with polymorphonuclear PMNL.
Polymorphonuclear leukocytes means the neutrophils.
Polymorphonuclear nucleoside, okay. 85% and shift to the left. C-reactive protein was 48 milligram. Arterial blood gas showed hypoxemia.
So let us analysis now. The patient has stridor. Usually, what is the most common cause of stridor in this small age is the
Acute
asthma.
epiglottis.
Yes, but sometimes it is a very severe disease which you must rule out. So we put here all the criteria of the severity. The patient has RD, respiratory distress. He cannot suck his saliva at 3 years old. So drooling saliva is a very ominous sign. And also, if you're speaking about dysphagia, I cannot eat. I cannot even swallow my salivation, with high fever, with toxic look, with irritability, and sitting in bed leaning forward. This is specific. You will find in Nelson a picture of a child sitting like that and write the diagnosis below it. So what is the diagnosis?
Acute epiglottitis.
Epiglottitis or acute tracheitis, both, but epiglottitis is the most common one. So acute epiglottitis. Positive organism is
Influenza.
That's why this is an extra vaccine which we insist to be given, inshallah, in our country. Okay. Sometimes if you did X-ray, you can see some changes. Okay. Encroaching on the air column, thumb sign, you will find the air column is very small. Okay. Emergency treatment, we may need to do tracheostomy, or intubation, and the intubation usually must be done in OR. Okay. It is just refreshing your mind. What about the cases you are going, inshallah, to meet? This is my references, and thank you. Hoping the best for you. Now it's your turn if you need to ask any questions. Any point do you need to clarify, please?
Doctor, I just wanted to clarify regarding when you said we can do a PE on the child when sleeping. Is it true?
Sorry?
You said we should take an opportunity, and you said it is kind of like allowed if we take the physical examination when the child is sleeping, or no? Because I didn't really hear when you said
what
that.
examination do you ask about? Sorry, to auscultate the heart.
Yeah, auscultate the heart.
Yes.
So it is permissible to auscultate the heart when the child is sleeping.
Usually for small children it is permissible, but just because the examiner doesn't prefer that, you just tell the baby is sleepy. Can I please I change my flow just to auscultate, and then after that I will go for my peripheral and system examination.
Okay, thank you, Doctor.
if it happened with me, I will give you extra. Okay.
Okay, thank you.
Okay. Tania, inshallah, you are off tomorrow for the Prophet sallallahu alaihi wasallam birthday, and if you need to celebrate, the celebration is to follow him. Okay. Thank you, and see you inshallah again.
Thank you, Doctor.
You're welcome.
Inshallah. Thank you, Doctor. Take care.
Take care, Doctor.
Thank you, doctor.
Assalamu alaikum wa rahmatullah.
Thank you, Doctor.
Thank you, Doctor.
Allah.
Thank you, doctor. Thank you, doctor.
You are welcome.